UNICEF South Africa is warning against a measles outbreak this festive season. The organization is said to be working with the national and provincial partners to tackle the measles outbreak that has spread across northwest Mpumulanga, Limpopo and Gauteng provinces. According to the latest National Department of Health figures, 169 measles cases have been confirmed across these four provinces. UNICEF is concerned that further spread is likely with the increased movement of persons during the holiday season. To take this discussion further, we're now joined via Zoom by Muriel Mafico, UNICEF South Africa Deputy Representative. Thank you so much, ma'am, for your time this afternoon. So you've raised this alarm then as UNICEF warning against the rise in the infections, this festive season. How severe is this a warning and more importantly, the issue of measles in the country?
The issue of measles in the country is an urgent concern for all of us because we know that measles is highly contagious. It can easily spread. We also know that measles in children that have not been vaccinated can actually be deadly. Therefore, we need to treat all these cases with the sense of urgency that they deserve. We need to urgently make sure that all children are fully vaccinated and therefore protected from measles.
How do you, inform South Africans? I mean, I would imagine the concern that South Africans are having currently, particularly as you talk about the infectious rates. How do then people avoid contracting the disease? And maybe talk to us then through some of the symptoms that people need to watch out for.
So in terms of how do we avoid, we go back to immunization. Vaccines work. Vaccines save lives. In fact, when you look globally, one of the biggest successes we have had as a global community is through vaccination. We have saved millions of lives that could have been lost due to vaccine preventable diseases. So our first message really is that vaccines work and vaccines can save lives. In terms of the symptoms, I think my colleagues that are in the medical field are in a better position to articulate that. But for laypersons like myself and others, typical symptoms will involve fever, runny nose, and even blotchy rash on the skin. Those are some of the typical symptoms that you can find in children that have measles.
Talk to us then about, you talk about vaccines being important and so on, but we know that across, various diseases and other infections, there is that vaccine hesitancy we're seeing, even as we talk about COVID-19 as an example. What then needs to happen? I mean, I recall reading some stats, nearly 40 million children across the globe missing that all-important vaccine. So there is a problem then as it relates to vaccines.
Indeed, there is a problem. In fact, globally, almost 25 million children have missed out on these life-saving vaccines. So it is a staggering number at the global level. And then here in South Africa, we have almost 100,000 children in South Africa who have not had their vaccinations done, which are really essential to protect the children. So we have children that are in what we call zero-dose communities. These are communities where you have a large number of children that have not even received any vaccination. So we are deeply concerned about this group of children because they are acutely vulnerable to measles and other vaccine-preventable diseases. We are also acutely aware of the fact that because it's highly contagious, the risk to the entire population, especially children who are most vulnerable, is very high. So that is why we have joined hands with the Department of Health, with the National Infectious and Communication Diseases, as well as other UN agencies like WHO, who have a key role to play in the health sector. We have joined hands with them to support South Africa's mass vaccination, which is currently being rolled out, starting with the 4 provinces where we already have a declared situation of measles outbreak.
When does it then become a red flag for you? I would imagine already you are treating it as such, but when does it become problematic, across the country? Because like we say, we are seeing these infections in 4 provinces, but because of this festive season, the likelihood is that much greater. When do you then inject a secondary kind of reinforcement?
So we are right now already in a declaration of outbreak in 4 provinces, as we mentioned at the beginning. In fact, when you have 3 cases in a single district in 1 month, that already constitutes, it actually determines and informs the need to have a declaration of an outbreak. So that is how grave the situation is. And now with all the movements that are happening, inter-provincial movements, when families are trying to reconnect during the festive season, as well as cross-border movements that are happening, we are aware that the risk is going to be even more heightened. And that is why we are supporting an awareness campaign. We have actually deployed what we call the track, which is a multimedia mechanism that we are using to go to different communities, taking the message about the importance of families, of caregivers, taking their children for vaccination and checking to make sure that they are fully vaccinated, not only against measles, but indeed against all the other vaccine preventable diseases.
All right, ma'am, thank you so much for your time this afternoon. Really good to speak to you. And of course, for that update, of course, that was Muriel Mafico, UNICEF South Africa Deputy Representative.